Thank you very much, colleagues. We're going to move on shortly to the next item of business, which will be an urgent statement from the Cabinet Secretary, Jean Freeman, on novel coronavirus COVID-19. And the Cabinet Secretary will take questions at the end of the statement. Before I call on the Cabinet Secretary, I know that there's a lot of interest in members about their own access to this building, visitors' access, and about the behaviour of staff at their local office. Can I suggest that I will make a very short statement? The corporate body met earlier. I'll make a short statement following the question and answers to the Cabinet Secretary about the corporate body's response. But can I begin by calling the Cabinet Secretary, Jean Freeman?
Thank you very much, Presiding Officer, and thank you for the opportunity to make this short statement. It will be a brief statement. I hope colleagues will forgive me for that, and for obvious reasons they don't have copies thereof. But as we've said before, as the First Minister said at First Minister's questions, with the Parliament's agreement, I intend to return on Tuesday at the start of business next week to make a further statement and update members further on that point. As members will be aware, I have returned from a COBRA meeting chaired by the Prime Minister and attended by our First Minister, myself and our Chief Medical Officer and my colleague Mr Fitzpatrick, the Minister for Public Health. And I will update you on the actions that are coming from that meeting. The first thing to say, as members will, I'm sure, be aware, today at 2 p.m, our normal time, we updated the number of cases of coronavirus in Scotland as 60 cases, with the evidence of a further 2 cases arising from community transmission. Members will be aware then that what we are seeing is a sharp spike in the number of cases and the emergence of community transmission identified through our community surveillance measures. What that now tells us is that we have moved here and across the UK from the containment phase to the delay phase. So in the delay phase, our initial objective and the steps that we will initially take is threefold. First of all, to slow down the spread of the virus. Secondly, to reduce the numbers of cases at the peak, as we spoke about last week, I believe, to flatten that peak. What that means, of course, is prolonging the length of time that the virus is with us, and to protect groups where early data tells us that those who are most at risk of developing a serious illness are those in our elderly population and those with particular underlying health conditions. It is important to understand, and for me to repeat, that for the vast majority of us who become infected by the virus, our symptoms will be mild and we will recover fully and quickly. But for some in our society, those groups in particular with whom we have the most responsibility to protect, they are at risk of developing a serious illness. The steps I'm about to outline are the first set of measures that we will introduce in this delay phase. As the phase progresses, there will be other measures to be considered and determined, and we will, of course, return and ensure that members are given full advice and information on those as those decisions are taken. So the advice has changed as follows. From tomorrow, those individuals who have symptoms indicative of coronavirus will be asked to stay at home for a period of 7 days. That is advice from our Chief Medical Officers based on the scientific advice and coincides with the World Health Organization advice. If you are in that category and the symptoms are a persistent dry cough and a fever, then we are asking you to stay at home for 7 days. You do not have to call NHS 111 or your GP. You should not be routinely calling them at this point unless your symptoms worsen or your condition changes for any reason, in which case, of course, you should seek additional clinical and medical advice. In this phase, we will not be routinely testing, but we will continue with our surveillance testing and sample testing. And to remind members, routine surveillance testing involves that sentinel group of GP practices and testing of patients currently in hospital, either in intensive care units or there as a consequence of a respiratory illness. Local authorities and schools will be advised against overseas school trips, and the Foreign and Commonwealth Office travel advice will align accordingly. We are not at this point advising school closure. That will be kept under review. There are a couple of main reasons why we are not at this point. The first is the fact of the matter that if we close schools, then pupils would have to be somewhere, and that somewhere where they might be would either be at home, which may result in a significant impact on our public services if their parents or others looking after them, or they will be in other local authority provision, which may, without any disrespect, not carry the same level of persistent hand hygiene and other matters that we see in our schools. But perhaps more importantly, if and when we get to a stage where we are requiring school closures, it will not be for 1 or 2 weeks. It will be for a number of weeks that will take us through until the summer. So that is a significant impact on those who would be affected. And the science advises us very clearly not to take these steps earlier than is required, for the simple reason that if we take them too early, they reduce the impact on spread. So that is why, at this point, the question of school closures remains under review, but is not advised at this point. In terms of mass gatherings, the Scottish Government position is to say that from Monday, we are advising the cancellation of events over 500 because of the potential impact that those events can have on our emergency services. It is not the case that the science says that gatherings, mass gatherings, closing those mass gatherings or stopping those mass gatherings has a particular impact on reducing spread. It doesn't have no impact, but it doesn't have in itself a significant impact. However, our judgment, and we have said before in this chamber that we will be guided by the science and the clinical advice, but our responsibility is then to apply judgment. Our judgment on that matter is that there are 2 reasons in which such mass gatherings should not take place. The principal one of those is where those mass gatherings require the presence of the emergency services or have an impact on the emergency services. And we require those emergency services to be focused on helping us contain the spread and treat those who are ill. The second is in terms of consistency of public message. We need to be clear with our population of Scotland that this is not business as usual. If we are saying to people with symptoms to stay at home for 7 days, this is not business as usual. And so we need to be consistent in the steps that we take as a government in order for those that we are asking to work with us to comply with these steps for their own health and for the health of those around them and for the health of all of us, that we are not inconsistent in the steps that we are taking. So there will be a number of questions, I know, on the application of that guidance in terms of mass gatherings, and what I will say to members is that over the weekend we will produce detailed advice that will be available to organisers before we get to Monday. The final thing I want to say, Presiding Officer, before I take questions, is to repeat what we have said, but I think it will bear repeating many times. There are no steps that we will take, that we have taken or we will take, that will make this virus go away. What we are trying to do is delay the spread it out over longer, bring the peak down so that we minimise the impact on our National Health Service and take steps to protect those who are most vulnerable to serious illness as a consequence of the virus. So our guiding principles here, in addition to being led by the science and the clinical advice and applying the judgment that we make in terms of some difficult decisions that have been made and are yet to come, is to delay, reduce and protect. And the very final thing I'll say, Presiding Officer, before I take further questions is, although we have moved out of the containment phase into delay, the importance of the public health messages about persistent hand washing, using hand gel if you cannot access hot water and soap, and taking care in terms of using tissues to catch sneezes and coughs remains as important through this next phase as it did at the outset. And I would encourage everyone to continue to apply those measures, and we will continue to keep the Chamber updated. And as I've said, with the Parliament's permission, I will return on Tuesday.
Thank you very much, Cabinet Secretary. The Cabinet Secretary will now take questions. I would encourage members who wish to ask a question to press their request to speak buttons. Can I call on Miles Briggs?
Thank you, Presiding Officer. It is clear from the statement we've just heard that our health and social care services are going to come under significant and sustained pressures in the coming days, weeks and months ahead. Can I therefore ask the Cabinet Secretary for the most vulnerable patients in our society which will need support, further to my question I asked last week, how many additional intensive care beds have now actually been commissioned in our NHS?
Cabinet Secretary.
I'm grateful to Mr Briggs. He is absolutely right. We have said this, all of us, I think, from the outset, that this virus will pose significant challenges on our NHS and our social care services, which is why the whole approach is as we've outlined. On Tuesday, when I return, I will be able to provide more detail on all of this, but I can let Mr Briggs know that all our planning is on the basis of increasing capacity in our hospital setting, increasing capacity in social care, and doubling the number of intensive care beds that we have.
Monica Lennon.
Thank you, Presiding Officer, and I thank the Cabinet Secretary for her statement and the offer to keep Parliament updated. She's absolutely right about the importance of hand hygiene, but I've been very concerned today and in recent days to hear from home carers who work for Cordia in Glasgow, from people working in GP practices and other frontline services who have run out of hand gel and wipes and other basic equipment, including gloves. So what is the government doing to respond to these concerns which have been raised by other members, and how quickly can people expect to get those supplies? And on the measures around social distancing, I note that it's large events as of Monday. Can I ask why Monday and not sooner? Many of us are acutely aware of a big football match happening in Glasgow at the weekend, and people are quite nervous around that. So why Monday and not sooner, Cabinet Secretary?
Cabinet Secretary.
So can I start with the point about social distancing? Because actually the advice that says, as of now, if you have any of symptoms indicative, and I've described those as a persistent dry cough or a fever, I'm asking people to stay at home. That is social distancing. It's one aspect of social distancing, and it's there in order to prevent spread of the disease. So if you have a dry cough or a fever, you shouldn't be going to any mass event over this weekend or at any point if you are going to help us and work with us in order to manage the impact of this virus. And that needs to be a really clear message. In terms of why Monday and not now, there are two main reasons. First of all, people need particular guidance, as I've said, that we will work on over the weekend about what actually does it mean in terms of mass gatherings over 500, who does that apply to and how would that be applied? And secondly, the events that are planned over the weekend are already planned. And in terms of the resilience of the emergency services, those steps are already in place, and stopping those events would not, at this point for this weekend, significantly increase the capacity we have in our health service, given the numbers of cases. What we are doing is planning ahead as we expect the number of cases to increase. On your point about supplies, not just hand gels, members have raised before and have raised directly with me, as have others, the question of personal protection equipment in our primary care settings and in our social care settings. We have asked very directly of all our health boards exactly who have you supplied, what have you supplied them with, have you made sure that the right clinical guidance is there about what equipment is needed and what isn't needed in that setting, and when do you intend to put out the next supply. Once we have that detailed information, and we will have that this week, then we will know where there have been gaps in that provision and take steps in order to fill those gaps. And we will make sure that the resupply is coming through very quickly. So we are actively engaged directly through our health boards with primary care and in our work with local authorities through the local resilience partnerships on the resilience measures that they are taking, but what they require from us by way of access to supplies, whether they have that in sufficiency to their own satisfaction or whether they require additional supplies from us through our National Procurement Service. So all of that work is underway and will continue right over the weekend.
Thank you. Alison Johnson, to be followed by Alex Cole-Hamilton.
I thank the Cabinet Secretary for her statement. The last thing people need to be worrying about right now is the security of the roof over their heads, and I'm sure the Scottish Government appreciates that it needs to do everything it can to help support low-income households through this crisis. Will the Cabinet Secretary encourage councils to offer flexibility on council tax, and can she outline what action will be taken to protect all tenants, including those in the private sector and the social sector, who find themselves under financial pressure as a result of COVID-19, to ensure that no one is evicted as a result of this health crisis?
Cabinet Secretary.
So I'm grateful to Ms Johnson for what is a very important question and will be a matter of worry to many people I know based on their incomes, the nature of their employment contract and so on. Some of that can be and is being addressed by the UK Government in terms of access to statutory sick pay, which has been agreed from day one, but also I understand, although we do not have the detail yet, but we will have that shortly, flexibility that the DWP intends to apply on the application, for example, of universal credit and other relevant benefits. The Scottish Government, as I think Ms Johnson knows, is giving active consideration, as the First Minister said at First Minister's questions today, as to what more we can do within our devolved responsibilities and powers to ensure that there is additional support to individuals in those circumstances, and the whole issue around flexibility around council tax, the payment of rents and how local authorities respond to that. I'm sure my colleague Mr Stewart and the Cabinet Secretary Ms Somerville will be, and Ms Campbell will be actively taking those forward in their discussions with COSLA. I think it's worth saying that I have very particular discussions very directly with COSLA in terms of social care and health, but my colleagues are discussing matters with COSLA on a regular basis with respect to schools and with respect to these matters as well.
Thank you. Alex Cole-Hamilton, to be followed by Ruth Maguire.
Thank you very much, Presiding Officer. Many thousands of our constituents require daily support from care workers who provide personal and social care in home to these very vulnerable people, many of whom will be severely at risk from this emerging threat. Can the Cabinet Secretary tell the Chamber what advice is being given to social care workers about the continuity of that care into those homes which those vulnerable people will sincerely depend on?
Cabinet Secretary.
I'm grateful to Mr Cole-Hamilton for a question on what is a very important area indeed, and that is the whole question not only of social care, but actually carers who provide care to family members or others. So again, as he will know, this is work that is undertaken in partnership with COSLA. We are actively looking at two areas. One is what can be done to ensure that that workforce is as high in number as we need it to be, bearing in mind that that workforce too will experience members of it who become infected with the virus, and there will be a higher than normal absence rate. So that is part of the work that's underway in terms of the redeployment of other public sector workers and some of the other measures that I spoke about on a previous occasion in terms of how we can bring others into that workforce in particular. But in addition, we are in discussion with local government partners about additional support, not only in respect of what Ms Lennon spoke about in terms of supplies and personal protective equipment, but also about training, where that training is needed, if for no other reason than to give care workers confidence that they know how to manage these situations when they are caring for more than one individual. And so that work is underway. Our National Education for Scotland and Health Improvement Scotland are gearing themselves up to be able to provide that very specific, bespoke infection prevention and control training to those individuals as quickly as we possibly can. And again, when I return on Tuesday, I'd hope to be able to give more detail to members on that, but also to ensure that more detail still, if you like, is provided to party spokespeople and leaders in a briefing that perhaps we could have next week, as we have done before.
Thank you. Ruth Maguire, to be followed by Brian Whittle.
Presiding Officer, can the Cabinet Secretary advise when social distancing measures should be followed and confirm people who have symptoms in keeping with COVID-19 should stay at home and self-isolate?
Cabinet Secretary.
So there are a number of steps to social distancing. The first of those we have taken, and that is the advice to individuals who have those symptoms indicative of the virus, that is that persistent dry cough and fever, to stay at home for 7 days. Other measures will include what steps we need to take for the two vulnerable groups in particular that I mentioned, those with underlying health conditions and those of our elderly population. And we will provide more advice in detail to both of those groups in the coming days. All of that requires all of us. I think the important thing for me to say again, Presiding Officer, is that this will affect all of us. Most of us will have mild symptoms. All of us will have a different way of conducting our daily business than what we are used to now. Life will change for all of us. For some of us, it will be more dramatic a change than for others, and therefore for all of us, we have a responsibility to help each other to get through this particular situation. Compliance with the measures that we are setting out today and those that will come in the days ahead are important. They're important that the members of the Scottish public trust the advice that we are given, that it is based on the science and on the clinical advice, and that where we are exercising judgment over that, then we make clear what that judgment is that we are making that leads us to take specific measures in addition to what the science and the clinical advice advises us. The measures on social distancing that we will bring forward over the coming days and weeks will be measures that are clearly assessed as having the maximum impact to delay the spread of the disease, reduce the peak of cases at any one time, and protect those that are most vulnerable.
Thank you. Brian Whittle, to be followed by Ian Gray.
Thank you, Presiding Officer. The Cabinet Secretary will remember I raised it on the question of pharmacy, the escalating cost of pharmacies replenishing their stock on Tuesday, and I was at a pharmacy event last night where it was raised with me that doctors are now double prescribing, understandably, but which in itself will exacerbate the problems of access to medicines. So can I ask the Scottish Government what we can do to ensure that essential medicines remain available, and can I also ask what advice has been issued to dentists and opticians specifically around PPE, and what priority has been given to provide access to masks and equipment for these healthcare professionals?
Cabinet Secretary.
Excuse me. So in terms of the first part of Mr Whittle's question, we are following up on the issue he raised with that particular pharmacy in order to ensure, whether we understand that is a one-off or if other pharmacies are involved in this. It is essentially, as I understand it, price hiking, exploiting the situation in order to hike prices, a completely unacceptable practice. And we will take what steps we can as a Scottish Government to try to stop that happening, but also in partnership with our colleagues the UK and in Wales and Northern Ireland to ensure that we are very clear and we take whatever necessary steps we can to stop price hiking in this area or indeed in any other area where that is possible. In terms of advice and guidance to frontline staff and of course our primary care staff, our pharmacy staff, key personnel in hospital settings, as well as, you have said, dentists and optometrists, that advice is available to them. More advice will be given, in particularly to primary care practitioners, about the pathways for patients that are in contact with them, about how they can access the additional support that they may need, and also what it is that we are asking them to do, including what we are asking them to not do. And we have been in touch with both the BMA's GP area and with the Royal College of General Practitioners in order to secure their support as well as their advice to us about what more we need to do in that particularly important area. Because, of course, one of the measures that will be taken, and we will give more detail on this, but in order to create capacity in our hospital setting requires moving some more of that care into the community setting. And we need to ensure that our primary care service in particular is confident and equipped and ready to do that.
Thank you, Cabinet Secretary. We have 9 more members wishing to ask questions. Ian Gray to be followed by Emma Harper.
The GMB union, who organise many local authority workers, have today expressed concern about the consistency of response and planning across those authorities. So, for example, can we be assured that any decision to close schools will be taken on a Scotland-wide basis and not left to 32 local authorities to take such a difficult decision?
Cabinet Secretary.
I would hope that we can be assured of that. Of course, we cannot instruct local authorities on how they should respond. They are autonomous bodies, but COSLA are a member now of the Scottish Government's resilience operation at the highest level, and so they will be party to the decisions that we take across government and therefore local government in terms of the future steps that we might take, as well as the resources and other steps that are needed in order to ensure that we can manage this situation as best we can. And in addition, of course, the Deputy First Minister and other colleagues in Cabinet are in direct discussions with those organisations through COSLA and other bodies in order to ensure that we understand the issues that they are raising and some of the concerns that they may be expressing to guide us in the advice and the decisions that we will take.
Thank you. Emma Harper to be followed by Jeremy Balfour.
Cabinet Secretary, I understand that no government in the UK is currently considering bringing in school closures at this time. But so could the Cabinet Secretary clarify, if such measures were to be brought forward, what the scientific advice would be on the necessary length on any such closure so that it would be effective?
Cabinet Secretary.
I'm grateful to Ms Harper for that question. The current scientific advice is that should we take a measure such as school closures and some of the others that we may bring forward, the length of time is between 13 and 16 weeks. And that is in order to ensure that you gain maximum impact on those objectives, which is to delay the spread, reduce the peak and protect those most vulnerable. Now, all of that is one of the significant pieces of advice that we need to take into account. The clinical advice too about how the virus is impacting on different age groups from the data that we have from elsewhere around the world, balanced against, as we've said before, the impact overall in terms of individuals as well as our public services and, of course, our economy. From my point of view, my primary responsibility is the health of the people of Scotland, and my job is to take whatever steps I think are necessary in order to protect them. There are other factors to be taken account of, and that is why we need to continue those discussions and keep this matter under review and ensure, as Mr Gray has highlighted, that we are listening to local authorities and taking account of any specific issues that they are raising with us.
Thank you. Jeremy Balfour, to be followed by Willie Coffey.
Thank you, Presiding Officer. While assistance for business is very welcome, has the Scottish Government considered how to support the third sector during this period of time? As you will be aware, the third sector often offer service to disabled and elderly people, and will they look at how they can assist them either financially or in other ways to make sure these services continue over the next few months?
Cabinet Secretary. So our third sector has always been a very important part of the services that are offered to the population in Scotland. In the coming weeks, it will become an even more important part as we need to manage an increase in levels of social care required and support for those who are the most vulnerable. Those discussions will be underway, I'm sure, by my colleague Ms Campbell, to hear from the third sector all that they can offer in this regard and what they might need in order to help them do that. And we will take those steps accordingly, dependent on the advice that she brings forward.
Willie Coffey, to be followed by Daniel Johnson.
Further to a question that was asked on Tuesday, can I ask the Health Secretary if we intend to require all those arriving at Scotland's airports on flights to be swab tested for the virus and to advise them to self-isolate until the results are confirmed one way or the other in order to help slow the spread of the virus?
Cabinet Secretary.
That is not currently the scientific or clinical advice to us, but I'm very happy to get more detail behind that and ensure that that is provided to Mr Coffey and, of course, to other members if they wish.
Daniel Johnson, to be followed by Gil Patterson.
I was contacted earlier this week by a constituent who relatively recently suffered from bilateral pneumonia, which included a period of time in intensive care. He naturally was keen to understand what advice and procedures would be in place for people such as him. When I contacted the Health Board, they pointed me towards Health Protection Scotland website, but that advice appeared to be for those who were already admitted to hospital. There's a general point about source of advice here, but for those in particular at-risk groups, particularly those with a history of respiratory illness, is there specific guidance being drawn up? How will that be disseminated? But importantly, in terms of diagnostic and treatment pathways, will there be prioritisation or triage for those with a history of respiratory illness?
Cabinet Secretary.
So in terms of the latter part of Mr Johnson's question, those are clinical decisions about how triaging is done, where priority is given, dependent on how an individual patient presents themselves. And it would be wrong for me to say something that is a blanket position when that is a very clinically driven decision, and our experienced and professional clinicians should be able to make those decisions. In terms of the wider question about underlying health conditions and advice, there are, I'm very conscious, a number of individuals who have underlying health conditions, some of whom are currently, for example, undergoing cancer treatment or recent transplant patients and so on. Where they are at the that high immune suppressed place, cancer patients, for example, they will already have guidance from their clinicians about, in normal course, the particular protective steps that they should take for themselves in terms of preventing infection and so on, and they should continue to follow that particular advice that they will have been given. However, our clinicians, led by our Chief Medical Officer and others, are currently working through very detailed guidance for a range of conditions that go from those who are most immune suppressed through to others who will have an underlying health condition which may trigger some additional risk to them. And that guidance will be produced and disseminated in the coming days. It will be done through our clinical networks, but in the case of some individuals with particular conditions, there is already a register of who they are, and we will use those registers to contact them directly.
Thank you very much. Gil Patterson, to be followed by Jamie Green.
Many thanks, Cabinet Presiding Officer. Can the Cabinet Secretary advise if moving to the delay phase will mean that there is no longer surveillance testing for COVID-19?
Cabinet Secretary.
No, there will continue to be surveillance testing in those three measures, three ways that I mentioned earlier. First of all, through our Sentinel group of GP practices, 41 of those in Scotland. Secondly, through swabbing of those individuals currently in our intensive care units and continuing in our intensive care units. And thirdly, those individuals admitted to hospital for a respiratory condition.
Thank you. Jamie Green, to be followed by John Mason.
Thank you, President Officer. Can I just clarify with the Cabinet Secretary, there's a big shift in the advice being given to the public. If we're moving from a position where if you think you have COVID-19, the previous advice was to phone 111, seek help with a view to being tested, moving to a position where you now should stay at home and only seek advice if you have severe symptoms or your symptoms are worsening. That is a marked shift in position in terms of the advice we give the public. How are we going to ensure that message is properly communicated so we don't overload the 111 system and that people can still feel that comfort that if they want to be tested, the options are there for them?
Cabinet Secretary.
I'm very grateful to Mr Green. That's a really important question. Essentially, what we are now doing is introducing the first of the measures that would be otherwise described as social distancing. And we're doing that because now the indications are clear that the virus is being transmitted through community contact and not solely through a travel history or contact with someone who has a travel history. So that was always going to be the trigger that moved from containment to delay. And that's also the reason why continuing community surveillance remains important, because that gives us an indication of the level of spread in our communities. So you're right that the advice has changed significantly. We are now saying to people, if you have symptoms that are indicative of coronavirus, that is that persistent dry cough or a fever, we want you to stay at home for 7 days. You do not need to, and we don't want you to phone 111 or contact your GP unless your condition worsens or you become ill in another way, in which case you would, as you would in normal course, contact and seek that additional clinical advice. Now, in terms of how we communicate that, obviously we will use our traditional broadcast and print media. There is an advertising campaign using both of those outlets and social media. There is a UK-wide campaign around that particular messaging. And if I may say so, there are a number of us in this chamber, all of whom have our own contacts, our own networks, our own responsibilities to our constituents, and communicating that through the channels that we would otherwise use to be in touch with our constituents would be an exceptionally helpful thing for all of us to do.
Thank you. John Mason, to be followed by Anas Sarwar.
Thank you. The Cabinet Secretary mentioned school trips, and I wonder if she could clarify what all's included in that. Is it only school trips abroad? What about residential trips within Scotland? What about day trips to the swimming pool? That kind of thing.
Cabinet Secretary.
So it is only school trips abroad, and the Foreign and Commonwealth travel advice will align with that particular advice. Remembering that if you have a child who is experiencing the symptoms indicative of coronavirus, that persistent dry cough and that fever, then that child should not be on that school trip. Whatever kind of trip it is, whether it is to a swimming pool, whether it is a trip to another part of the UK, whatever it might be, that measure, which is the most important shift in the advice that we are issuing today, that measure applies to all of us. But otherwise, school trips in the UK or to a swimming pool or whatever it might be can continue, and the only school trips that we are giving strong advice should be stopped are those trips overseas.
And Anas Sarwar.
Presiding Officer, during my point of order after FMQs, I raised a concern that had been brought to my attention by GPs in Glasgow, Renfrewshire and Lanarkshire. Can I thank the Cabinet Secretary for taking immediate action on that, because this afternoon every GP practice in Greater Glasgow and Clyde did receive a communication from the Health Board saying that the government had taken measures after that point of order to make sure extra supplies would be available, including fluid-resistant surgical masks, disposable gloves, disposable plastic aprons and eye protection. Can I ask the Cabinet Secretary whether we have adequate supplies of all of these things for right across the country, how quickly it can be distributed to every GP practice across the country, and whether this will be uniform across the country as well?
Cabinet Secretary.
So it certainly should be uniform. I'm glad to hear from Mr Sarwar confirmation that what we asked to be done was done. We asked that of all our boards, so I would expect it to have applied across all our boards. We will continue to check that it has done, and we will continue to check that it is done, because those frontline staff are critical in our response to this situation, and we need to do everything we can to protect them so that they can care for and protect others. In terms of supplies and how confident we are, our National Procurement Service is well versed in looking at how to ensure there are forward supplies. They have been doing this from the moment we were first aware of this virus, so before we got to any of these particular steps. They continue to do that. They are linked to the UK-wide supply service. And so, for example, with respect to kit like ventilators and so on, they are linked into that so that we are looking at a UK-wide supply, although there are particular steps that can be taken in Scotland for Scotland as there are in England for England. So at this stage, we continuously check with NSS, and they would undoubtedly flag directly if there were any difficulties, but at this stage we can have confidence that there are supplies available and steps are being taken to ensure the continuity of those supplies.
Thank you very much. And can I thank the Cabinet Secretary for taking the time to come back to Parliament this afternoon to update us following developments in the coronavirus COVID-19 case. Now, I'm aware that members are also quite anxious to find out what arrangement Parliament is making and what arrangements or advice we have for members to make in their own offices. And I would like to take this opportunity to update members. The corporate body met today to hear from the Chief Medical Officer for Scotland and to consider the Parliament's response as the UK moves into the delay phase of its response to COVID-19 coronavirus. Can I say at the outset that the corporate body takes its responsibilities very seriously indeed to keep safe those who work in Holyrood, in our local offices, and all those who visit both locations, and this will continue to be at the forefront of our minds. At present, and consistent with public health advice, there is no change to the public access arrangements to the Parliament. This is very much in line with advice that schools, colleges and other public institutions should remain open and is consistent with the public health message across Scotland. We would repeat the advice, however, for those with symptoms of the virus to stay away from Parliament, to stay at home and to self-isolate. This is, of course, a rapidly developing situation, and the corporate body, with officials, will be closely monitoring developments on a daily basis. Today, we have considered carefully some of the practical steps we can put in place to best support those working in Holyrood and in the local offices. We are therefore making changes to the members' expenses scheme to provide flexibility for members to access temporary staff provision, and are also advising members to follow the Parliament's special leave policy for staff absences as a result of self-isolation and virus-related illness. Detailed information on the measures we are putting in place and where to go for the latest health advice will shortly be issued to you and to all pass holders. We are also creating a dedicated phone line and will be adding a frequently asked questions section to the Parliament's website. Officials are, of course, very happy to answer any questions you may have. Now, we do recognise that this is an unsettling and for some deeply concerning time, and I hope I can assure you that as the situation evolves, we will do everything necessary to review our services in order to ensure that we sustain business safely at Holyrood and to provide everyone who works in and around this building or in our local offices with the best advice possible. Thank you for that. And yes, a point of order from Bruce Crawford.
I'm sorry to do this and to hold the Parliament up because I know people have appointments they want to get to. We've been provided with this statement quite rightly by yourself, Presiding Officer, and I'm very grateful for it. And I know we're going to see this advice later, but I just wonder, in that advice, will it also give us some advice in terms of not just our constituency staff, which would be very valuable, but how we should go about holding things like constituency surgeries in future, etc. And will we be provided with an opportunity at some stage to ask similar questions of either yourself or officials in the Parliament in the way we are doing with Jean Freeman in regard to how the Parliament operates, particularly for the future around things like cross-party groups, etc. I think it's something we all need to hear a bit more about.
Indeed, thank you very much to Mr Crawford for those questions. These are very much the issues that we discussed at the short notice meeting of the corporate body we held at lunchtime today, and they are issues we will return to both with officials and with the corporate body. The advice at the moment is to continue business in our local offices. However, it is important that members listen to the public health advice that the Cabinet Secretary has just outlined and that is available on the health websites. The Parliament will make sure that members are fully aware of any change to that advice, and it is a rapidly developing situation, so I would give that member that assurance. We will also look at any opportunities that are needed to provide, for example, if we need to return to a question and answer session in the chamber. At the moment, we would encourage you to direct your questions to officials who will make themselves available to answer the very questions you've put. I hope that reassures the member. Now, if we can, we're going to move on to the next item of parliamentary business, which is consideration of business motion 21237 in the name of Graham Day. On behalf of the Bureau, can I ask if the Minister will move? The Minister will move.
Move, Presiding Officer.
Thank you very much. No members indicated they wish to speak on the motion. The question, therefore, is that motion 21237 be agreed. Are we all agreed? Yes. We are agreed. And I would just emphasise that moves, that adds a statement on coronavirus on Tuesday and actually moves our decision time to 5:45 on Tuesday to allow questions on this subject once more.